goodness. All right, we're gonna dive straight into the case study. We're gonna talk about, you saw the title, domestic violence, abuse, all kind of cool stuff. There's tricks and traps, things to pay attention to because those case studies are very tricky, all right? So let's go ahead and I'm gonna dive into this. I'm gonna share my screen. So listen, read everything on the page. Most importantly, you need to follow me on Instagram at AlphaSlice and my NCLEX page, which is called NCLEX QBank. All right, listen, just fair warning. There's a lot of fake pages that pretend they're me. Those are my only 2 pages on Instagram. Of course, you can follow me on Facebook, AlphaSlice, and NCLEX QBank, and also on YouTube, AlphaSlice. All right, give me a follow everywhere. Subscribe to my channel everywhere. If you get any value from this case study, please share this video with a friend, all right? Without further ado, I'm gonna click the arrow. This is an unfolded case study scenario, and you already know with unfolded case study scenarios, you have 6 questions, right? A very popular saying of mine, this is what I tell my students, time is not your enemy, only wrong answers. So please take your sweet time, especially when you're reading the case study. Make sure you understand everything you're doing, and you're gonna see the algorithm, the approach of how I answer case studies, how my brain works, my critical judgment, my critical thinking. I'm gonna walk you through every step, and please mimic whatever I'm doing when you are studying. And if you are one of my students, then you know we do that with every case study until it becomes a habit, all right? So let's go ahead. So the nurse is caring for a 60-year-old female in the emergency department, right? So at 10:30 in the morning, the client is accompanied by her adult daughter at the hospital today. So the patient reports severe sharp stabbing pain rated 8 out of 10 in her right upper extremity, right? So listen, so you already know we have our laminated paper on your NCLEX. You need to make sure that you write down important information like signs and symptoms, lab values. You're gonna see complications, whatever case might be. So first off, we're gonna say the patient has pain rated out of 10, right upper extremity. So right upper extremity, 8 out of 10, all right? Now the type of pain is sharp stabbing pain. I'm not gonna write this down, but I'm just gonna remember it, right? So the pain is rated 10 out of 10 with any touch or attempt to move the arm, right? Right arm. The distal forearm is swollen and it appears grossly deformed with a limited range of motion below the elbow, right? So below the elbow, limited range of motion, and then the distal forearm, all right? So this is proximal to me, this is distal, so by the wrist. So the distal forearm, you got limited range of motion, right? Distal forearm, swollen. So I'm just gonna keep that in mind. Remember, on case study scenarios is different from traditional questions, right? Traditional question, you got a text, 4 options, you gotta choose one of the options. You're good to go. But with case study scenarios, the algorithm is different. You need to visualize the setting in your head. So in my head, I already know how an emergency department look like, how a 60-year-old female looks like. She's dependent on her daughter, so she's walking with her daughter. Her daughter is younger, so I can visualize that. And also, her arm looks like, I don't know, broken. I don't know, maybe it's, I don't know. There's a certain deformity, right? It could be a trauma. It could be, a thrombus, whatever the case might be, we'll see. But I can visualize that she's walking and her hand is swollen. She's in so much pain. Can visualize what she's wearing, right? An old woman, fragile. So in my head, I visualize that. And listen, this is the importance of visualization because when you visualize, you'll never ever pick up an option wrong. I'm telling you, do that and you will save your case study. You'll get 6 out of 6 questions correct, right? So you're gonna see what happens. So the patient is alert and oriented, avoids eye contact, and remains mostly silent throughout most of the intake assessment. All right, so listen, so those are very important information that they're saying, right? Alert, oriented, that's normal. Avoid eye contact. So I'm gonna put here, avoid eye contact so that I don't forget, right? So avoid eye contact and remains mostly silent, right? Remains silent. All right, cool. The patient's daughter reports that she lives with her mother and has assisted her around the house for the last 2 years due to her mother's frailty following surgery several years ago. All right, so the daughter lives with the mom and the mom is dependent on the daughter at least for the last 2 years, all right? So keep that in mind. She says her mother tripped down the stairs when bringing home groceries 2 days ago. All right, so this is very important. So because the patient came with a swollen arm, so we need to know that happened 2 days ago, right? So 2 days ago, what happened? Fall, right? So she fell down the stairs 2 days ago. The daughter says that the pain in her mother's arm has gotten worse over the past few days. The patient has a past medical history of depression. All right, so we're gonna write here, past medical history. You got depression. What else? She also has type 2 diabetes, and also amputation of toes of her right foot 2 years ago. All right, so I'm gonna amputation, right foot. So I'm gonna put here 2 years, right? So what else? And she's broken her nose 6 months ago. So nose fracture 2 months ago, they said? 6 months ago, all right? And what else? And a broken ankle 18 months ago. All right, so ankle fracture, did you say 8 months ago? 18 months ago. All right, cool. The primary care physician was notified of the patient condition. All right, so this is not the first time this patient has broken something, right? So there is a trend here. She's clumsy or she trips. Maybe the home environment is not safe, is not prepared for an elderly patient. Maybe there's rugs on the floor, maybe there's no side rails. The patient keeps falling left and right. So we need to pay attention to that. 18 months ago, ankle fracture. 6 months ago, we had nose fracture. And then right now, just 2 days ago, the patient had maybe arm fracture, right? So we gotta keep going. This is the question, right? So this is a select all that apply question. You already know with static questions, we use the strategy true or false. If you watch any of my previous case studies or videos, you know that it's true or false. What does that mean? It means that I read the first option and I make a decision. Is this a true statement or a false statement, right? If a true statement, I keep it. False statement, I get rid of it. But I don't read all options and then I go back to decide. No, that's not how it works, all right? With every option you ask, is this a true statement or a false statement? And then you make your decision before you move on to the next one. Listen, with static questions, if you read all the options, then you're just confusing yourself, distracting yourself. But you treat it one option at a time, all right? Okay, so the nurse reviews assessment. So the nurse reviews assessment data in the nurse's notes, which we just read. Select all findings that would require immediate follow-up by the nurse, all right? So it's immediate follow-up. Now, with static questions, sometimes they ask, there's another form of static question called SATA-N question, where they would ask you the 3 top things that you need to immediately pay attention to. In this case, they didn't give you a number. That's the N stands for a number. They didn't give you a number, just static question. So it could be as much as possible. It could be all of them, it could be one option, all right? So do not get intimidated, and the way of not getting intimidated is by you treating it as true or false, one at a time, all right? So the patient, well, let me deselect that. The patient reports severe sharp stabbing pain, 8 out of 10 in the right upper extremity. Of course, 100%. That's immediate follow-up. I need to pay attention. What? Is there a broken ulna, radius? Is the nerve compromised? What is going on? The patient cannot move it, right? Pain 8 out of 10, I need to treat that pain. So of course, it requires immediate attention, all right? Past medical history of type 2 diabetes. None of her symptoms are related to diabetes. It looks like it's under control, so I'm not gonna worry about that. Past medical history of amputation of toes on her right foot 2 years ago. Again, this is related to diabetes, which it looks like it's under control because we didn't even mention it, all right? Past medical history of broken nose 6 months ago. Yes, of course, I wanna ask. So it needs immediate follow-up because I need to ask, hey, what happened 6 months ago? How did you break your nose? Maybe you got in a fight, or maybe you fell down, you caught an elbow, you hit a closet, like what's going on, right? So definitely immediate attention because I need to go deeper into my nursing assessment. Past medical history of broken ankle, same thing, right? How did you break the ankle? What happened? What's the circumstances around that? I need to ask questions because apparently this is a trend. And if you don't have a safe environment, we need to offer you a safer environment. All right, pain rated 10 out of 10 with any touch or attempt to move the arm, 100%, right? Pain needs to be addressed immediately. It's 10 out of 10. Like you cannot even communicate with the patient and get information if she's 10 out of 10. Now in this case, we know that the daughter is talking for the patient because the patient is staying silent, right? All right, let's see here. The distal forearm is swollen and appears grossly deformed with limited range of motion below the elbow. Yes, of course, immediate attention. The patient is alert and oriented. This is a true statement. Like I'm not saying like this is normal, right? So I don't need to pay attention to that. I'm only trying to look for things that are abnormal but also needs attention right now. The patients avoid eye contact and remain mostly silent throughout the intake assessment. So I want to know, why are you being silent? I'm asking you questions, right? I'm addressing the patient. You see the daughter keeps talking for the patient, answer, but I want to hear from the patient, right? What's hurting you? Where's the pain? You know, how is the pain? With movement? Is it radiating somewhere? So I need the patient to actually communicate with me instead of staying silent. The patient's daughter reports that she lives with her mother and has assisted her around the house for the past 2 years due to her mother's frailty. All right, yes, definitely this requires immediate attention because, hey, if you live with your mom and you take care of her and she fell down the stairs 2 days ago and in the past she has a history of fractures, why you didn't think that this is a fracture too and take her to the hospital? Why did you just take her 2 days later, right? So maybe the daughter is negligent, maybe the daughter is not a good caregiver, so I need to investigate that more. So of course I'm choosing this option. And now here, she says her mother tripped down the stairs when bringing home groceries 2 days ago. Of course that requires more investigation. Again, I need to think of the environment. Why did she fall? Was there wet floor? The stairs were wet? Was it slippery? Is there rugs? Did she trip over something? There's no handrails. I need to ask more questions, so absolutely it requires immediate attention. Then this option, the daughters say that the pain in her mother's arm has gotten worse over the past few days. Again, she's just giving me information. And lastly, past medical history of generalized depression. Again, there's no signs of depression here. Yes, the patient is silent, but my brain is not going there. All right, so now let me break the news of how my brain is thinking after, you know, going through this first question. In my head, I'm like, there's negligence. In my head, the client, which the patient, is silent. It feels that she's in fear because it feels that the daughter may be negligent or maybe abusive, right? Now, the elderly patient, she's 68 years old, so of course she's dependent on the daughter. So maybe there's abuse, maybe there's neglect. I don't know what's going on there, but I need to investigate. The first thing that I need to do, I need to gather more information. What's going on? Now, the daughter is talking too much. I need to hear the patient. So the first thing I want to do is stop. Do I have your permission to talk to you alone? Take you to another room. That's my head, right? In my head, if you know abuse, if you know neglect, and by the way, like this case study, we do not talk about content, right? But I'll have another video for you where I explain abuse, I explain domestic violence, I explain neglect. So please stay tuned. Watch the next video because you will enjoy it, all right? So that's where my head is going after this first question. And again, you just visualize the setting. When you visualize the setting, you'll make sure that you don't get questions wrong, right? So I'm gonna go ahead and click this arrow. Now the next question, this is question number 2 on the case study. Remember, with my case studies, if you have watched any of my other videos, if there's any new entry, new information, I highlight it in blue. But remember, on your NCLEX, nothing is highlighted in blue. Everything's gonna be, you know, the same font, the same color. So you make sure that you go over what's going on your screen, what's going on in the case study, and make sure there's no new entries that you're gonna miss before you read the question, all right? So here it seems there's no new entry. So the question is, based on the assessment data, the nurse suspects that the patient is most likely experiencing so and so. So select 2 options. So this type of question, when they ask you for 2 options, this is SATA and question, so I only want 2 options, right? All right, so I'm gonna read the options. A depressive episode. I'm gonna read the question again, all right? So I make sure what they're asking. Based on the assessment data, the nurse suspects that the patient is most likely experiencing. What is the patient experiencing, right? Is she experiencing a depressive episode? This is not a depressive episode. So what happened? Like I got depressed and I fell down the floor or banged my hand? No, right? So I'm not thinking of depressive episode, even though abused patients, victim of abuse and domestic violence, they absolutely go into depression, right? But this is not the case here. We're talking about maybe a broken arm or abuse, like what happened, right? A fractured arm for sure. I'm thinking of a fractured arm. Fell down the stairs, arm swollen, in pain, 100%, deformity, 100%. Neurological dysfunction. Now, okay, so this is the dilemma. Now, yes, there could be a neurological dysfunction where, because the arm is not moving, the nerve is compromised, and maybe you want to think they mean neurological dysfunction where the patient has a neurological disease, maybe myasthenia gravis, maybe her muscles are not working properly, she's not coordinating, that's why she fell down the stairs. Now you need to make a clinical judgment by what you see in this case study. If that is the case, or you got the last option, which is domestic abuse, right? So what do you go for? Now, if they ask 3 options, 100%, I'm gonna select fractured arm, neurological dysfunction, I'm gonna select domestic abuse. That's when you need to make a decision. What do you think? You need to have good, sound clinical judgment. Now, my judgment is 100% domestic abuse, right? Okay, I'm gonna click the arrow, move to the 3rd question. I'm gonna look for new entries. There's nothing in blue. So the question is, with concerns of possible abuse, the nurse recognized that most immediate intervention would be. So what's my next step? And you visualize yourself in that setting. You ask your questions, you're trying to assess, right? Like you're not conclusive, like you're thinking maybe there's abuse, right? So if you're thinking maybe there's an abuse, what would be your next logical step, all right? Let's read the option. Provide empathetic listening so that the client feels comfortable sharing her concerns. But again, if I empathize with the patient and the patient feels my empathy, she's scared of the abuser because the abuser is standing there, is she going to share with me her concerns? I don't think so. You know anything about abuse? No, they look at the abuser and they wait for permission to answer that question. Otherwise, they stay silent. All right, the second option, separate the client from her daughter. And absolutely 100%. Absolutely 100%. This is the right answer. But before I select it, I'm gonna go ahead, and you know what? I'm gonna select it because I can deselect it. And also on your NCLEX, when you select an option, you can deselect the option. But if you click the arrow and you move to the next question, you cannot back up, right? So please pay attention. The moment you wanna select the arrow to move to the next question, you need to make sure that you are 100% confident that it's the right answer. So I'm gonna read the 3rd option. It's, by the way, you know, my phone rings 24/7. You know, we've got 48,000 students on the program. So this is my work phone. I've got my personal phone, which I'm gonna give you my number in a second because you're amazing. You've been watching this far, and I wanna give you as much value as I can because I want to change your life, all right? We helped 27,000 students pass the NCLEX in the last 2 years. And you're no different. Whatever your confidence level is, whatever your test anxiety is, trust me, I'm gonna change all that. I'm gonna bring your confidence to 100% and bring your test anxiety down to 0 by a few steps, few algorithms, a few blueprints. I'm gonna tell you about it by the end of this video, right? So initiate a referral to the psychologist on site. I mean, yes, obviously this patient needs somebody to talk to open up. I need that, but we're only choosing one option, right? What is the most important, most immediate intervention that I need to do? It's not a psychologist. I still need to go further with my assessment. Number 4, notify the security guard on site. Sometimes people make a mistake and choose this option, but again, you only notify a security guard if and only if the patient got aggressive with the abuser or the daughter got aggressive with the patient. As long as there's no threats, they're not physical, they're not shouting at each other, there's no reason to call security, right? Now, if the patient says, please call security, I don't want her in the room, 100% you do, right? But in this case, that's not the scenario. So what we're gonna do, we're gonna separate the client from her daughter because we wanna talk to the client alone, all right? So click the arrow, move to the next question. This is question number 4. And of course, I told you, we highlight them in blue, we have new entry. So the primary physician placed an order for stat x-ray on her right arm and morphine 5 milligram IV every 4 hours as needed for pain. I mean, I expected that, right? Didn't you? Of course, that's the clinical judgment. The more experienced you are with those case studies, with the scenarios, the more you can visualize that. The more clinicals you've done. I got some of my students are international nurses that work for like 10, 15 years, maybe 2 years, 5 years, so they have experience in that. Then they can make better judgment because they've seen such patients before, right? So that's for morphine as needed. Morphine was administered and the patient reported a relief in pain within 10 minutes, okay? Awesome. So listen, this is what I'm gonna do. Because we had pain at 8 out of 10, right? So what did we do? We administered morphine sulfate. Listen, I don't like abbreviation, but with my notes, I abbreviate just for quickness, but I know what I'm doing. But when you're typing, nurses' notes, do not abbreviate, not even one single word. Trust me, I've been a nurse for 21 years, and I've made that decision from day 1 in my nursing career, and I've never ever done a mistake. But I've seen colleagues who messed up so many times on their documentation just because they abbreviate, all right? So listen, we gave morphine sulfate 5 milligrams, and now the pain is 5 out of 10, right? So pain is now 5 out of 10. The patient was transferred to radiology for the x-ray. At 11, the x-ray is complete. The primary care physician diagnosed the patient with fracture of the right ulnar bone, all right? So let's see, I'm gonna put here x-ray because this is diagnostic in blue. So x-ray, and it shows right ulna fracture, right ulna fracture, right? Awesome. So 15 minutes later at 11:15, with the patient's consent, she was transferred to a separate room independent of her child after the x-ray. When asked again about the nature of the injury, the patient reported that her daughter pushed her on the floor. Right? Now we know. And the only way for us to know that this was abuse is because we took the patient separate from the abuser, right? And when you talk to the patient alone, they will tell you, they will tell you exactly what happened, but then they'll tell you, please, I don't want to share this information. I don't want to call the cops. I don't want to tell the police, or the other way around. They'd be like, I need to tell the cops. I want to weigh out, and then you advise accordingly, right? But you have to respect the patient's decision, whatever it was. If she said, I don't want to call the cops, then you should not call the cops. And if she said, I want to call the cops, then you got to call the cops, all right? So let's see. She reported it was not her daughter's fault and that she's a burden to her family due to disabilities and all of the help she needs. All right, so listen. So the patient feels a little guilt, right? Because she feels she's a burden on the daughter. You know, she needs somebody to take care of her. She needs maybe ADLs, whatever the case might be. She feels guilt. That's why she gets abused. Maybe the daughter has some anger management issues. So she gets abused and she accepts the abuse because she has nowhere to go, right? Now, if we offer her other resources, hey, you can go here, there are communities, there are adult daycare, there's so many places you can be, then the patient might change her mind and she might say, you know what, I don't want to get hit anymore. I would rather go there, right? But you need to give the patient those options, those tools, so that, you know, they know what they're working with and what's the support that they can get. All right, so she says that her daughter loses her temper sometimes, but she feels terrible afterwards, right? And that happens with every abuser, right? An abuser beats up, you know, his, let's say the victim, right? The abuser beats up the victim and then they apologize, ask for forgiveness, and maybe take them out on a date and get them flowers and feel remorse. But there's no way an abuser will change their habits. No, it's gonna be more, it's gonna be more frequent and it's gonna be more aggressive. But the only way for the abuser to actually change their habits and start treating themselves, you know, not to abuse others, is when the victim talks to somebody and reports them, and then they will get the proper help. Otherwise, that's not gonna change. On the contrary, the abuse is gonna be more frequent and more aggressive, right? So the patient says that she does not want her daughter to get in any trouble. All right, let's go ahead and read the question. So this is a SATA question as well with 5 options. So for the following list of potential nursing interventions, select any that are indicated for the care of the patient, all right? So I'm gonna read it again. For the following list of potential nursing intervention, select any that are indicated for the care of the patient. Number 1, obtain the patient's consent to photograph her broken arm. Of course, I need to take a picture of her arm because I need evidence. You keep that in the patient chart, and whenever you inform or call adult protective services or law enforcement. Now, you cannot force the patient herself to call the cops, but you can call the cops on her behalf, right? Because that's the facility policy, right? You need to inform adult protective services that you suspect abuse, and you need to inform them. In this case, it's not just suspect, but you have your word against, you know, the daughter because the patient told you that she pushed her on the floor, right? So you need to report that on the patient's behalf, but you cannot force the patient herself to call the cops, right? And then investigation will take place. So 100%, I need a photograph. Respect the patient's autonomy and confidentiality by keeping her concerns private. By keeping her concerns private does not mean that you are not going to inform law enforcement and adult protective services, but that means autonomy and confidentiality means you are not going to force the patient to call the cops. You are not going to confront the daughter and say, hey, you pushed her, she told me. You cannot do that because you're gonna aggravate the situation, right? But what you can do is you can call adult protective services or law enforcement, and they will do the investigation, and then you will leave it up to the patient, right? Because of HIPAA, you leave it up to the patient, especially if the daughter is not on HIPAA, on the HIPAA list, then you leave it to the patient to tell the daughter whatever happened during that conversation when we took the patient into a private room, right? So she could say, I didn't say anything, whatever, they suspected it, and you know, just to protect herself. But then at the end of the day, you cannot confront the daughter and say, oh, you pushed her or you kicked her or whatever, right? Respect the, so 100%, yeah, I need to respect the autonomy and confidentiality by keeping her concerns private, but not private from my team members, the interdisciplinary team, law enforcement, and adult protective services. Initiate a consult for social worker services. Yes, somebody needs to talk to the patient so that she opens up and they can offer her resources, exit plan, any of those strategies. You know, what are resources in the community? So a social worker will give her those options so that, you know, the patient knows that she has options. Like she doesn't, no one ever has to sit in an abuse situation. Insist that the patient remains separate from her daughter for her safety. I mean, you cannot insist if the patient and this is the autonomy part, if the patient does not want to be separated from her daughter, then that's her option, even though you know the daughter is an abuser. But if the patient said, hey, I want to stay in the same room, then you've got to respect that and stay in the same room. Especially because the patient is alert and oriented. It's not like the patient is not there, right? If the patient is mentally incapacitated, then yeah, for sure, 100%, you make that decision. But if the patient can make decisions for herself, she's oriented, she's alert, then definitely do not make that decision for her. So notify adult protective services and the relevant law enforcement agency for the concerns of the patient. Yes, absolutely. 100%, I'm gonna do that, all right? So those are my optional selections. Listen, with those options, it's very delicate, but if you know your role and you know the policy, then you just follow policy, right? So sometimes you might make a wrong clinical decision thinking that you're doing the right thing, but this is the right thing. All right, I'm looking for new entries. There's no new entries. So the question is, prior to the patient's discharge, which of the following actions would be a priority for the interdisciplinary team, right? Select all that apply. All right. So create a safety plan with the client and identify backup housing. Yes, absolutely, right? So you need to tell the patient, hey, you have this option. If you ever get in a situation where you're abused, you need a way out, then you've got adult care services over here, or you know, this community, like this center in the community where you live, where you can stay there, whatever the case might be. Now, social workers usually, you know, give those options, but 100% they need a safety plan as backup. Insist that the client file a report with the police. You cannot insist on the client if she doesn't want. You should not insist, right? Client is completely aware of her situation. She's adult. She's oriented. She's aware, right? So I cannot do that. I mean, I can recommend it once, but I cannot insist. I can insist is a keyword. Provide the client with a brochure about a local adult daycare program. Yes, 100%. In a clinic where, especially in the emergency department, you definitely need flyers, brochures, posters on the wall in the doctor's office talking about domestic violence and abuse. In the bathrooms, those are hanged everywhere so that anytime a patient is being abused, they look at that brochure, they read it, they look at that painting, they read it, and the poster, not painting, they read it and they think more about their situation and they take action. But we need to put so much awareness in emergency department, in different departments, in clinics, outpatient clinics especially, right? Urgent care, convenient care. We need to have those everywhere so that patients who are being abused know that there are resources, there's support groups that's gonna help them, all right? So definitely, 100% I need to provide the client with a brochure about local adult daycare program. Completely refer to outpatient counseling services. 100%, you know, the patient needs to talk to somebody. A family discussion between the client and her daughter, hell no, right? Because I cannot expose the client and tell her, oh, like we cannot have that communication, because if the daughter knew that the patient said that, you know, she pushed her, then it's gonna escalate the situation, and who knows what's gonna happen when they go back home, when they're being discharged. So 100% upon discharge, you don't do that, all right? All right, clicking the arrow, I think this is the last question, question number 6. All right, we've got new entry, it's in blue. At 12 noon, the primary care physician with the interdisciplinary team were notified of the patient's report of her injury. Reports were completed by facility protocol. All right, at 12:30, the patient requested to return to the room with her daughter. She states that she understands the material provided by the healthcare team and is aware of the resources available for her, which is amazing, right? She says that she does not want to press charges against her daughter or pursue this issue further at this time, right? Now, 100%, you need to respect that. You cannot make her do anything, but on your end, you just have to follow facility protocol, right? And if the protocol, which in most facilities say the same thing because that's a state law, you need to call, you know, law enforcement, you need to call adult protective services, so you do that, all right? And then you type everything in your nurse's notes. That's a must. The patient was transported back to the original room in the emergency department with her daughter, right? Now, what's the question? Once back in the patient's room, Her daughter has several questions about her mother's condition. Which of the following responses from the nurse would be most appropriate? Select all that apply. Now, for me, the first thing, I've been a nurse for 21 years, but the first thing I do is I'm gonna check that HIPAA list, right? Are you on the HIPAA list? Can I talk to you? Can I tell you information about her? Now, if she's not on the HIPAA list, I'm gonna tell her, please refer to your mother. She will tell you, like we informed her about everything that's going on, and she will tell you what she needs to tell you, right? You're gonna leave it to the patient. All right, so let's see. So the first option, I'm concerned about your mother's safety due to the nature of her injury. Again, it's like poking around the bear. You know, you're trying to say, because the daughter said she fell down the stairs. Now, when you say a comment like that, that means that you're not trusting what the patient is saying, right? So I will definitely not choose this option. Your mother has a broken arm and will need to receive a cast. Again, this is confidential information with the patient. I need to know first if the daughter is on HIPAA. I'll leave that information to the mother to reveal. Does your mother have a healthcare power of attorney? Yes, I need to ask that question, right? I asked the daughter. So let's see, what the question said. Once back in the room, her daughter has several questions about her mother's condition, right? So the easiest way to tell her, hey, no, I cannot tell you, is by asking, does your mother have a healthcare power of attorney? Which means, are you on a HIPAA list? And she says, yes. Is that you? No. So I cannot reveal any information. You've got to talk to your mother. Your mother will reveal the information. And if she says no, you say, I'm sorry, it's by policy. That's patient confidentiality, and I cannot talk about the patient's condition, even if you're her daughter, right? So you explain that politely, respectfully. I'll let your mother explain her situation to you. Yes, all right, so you say, I'll let the mother explain the situation to you. I will notify the physician of your questions. Again, it's not about the daughter's questions, it's about the client's questions. So if the patient has questions, she can ask her questions, and then the nurse or the physician would answer the client's question, but the physician will not answer a family member question, especially if they are not on the HIPAA list, right? They cannot expose that medical information, right? So click the arrow, and of course, like here, there are way more detailed explanation about rationale about every question. I will put a link for this case study so that you can review it whenever you want. But again, if you're seeing this on YouTube or on social media, you will not have a link to the case study. You need to go to the website, freengn.com, and then you got a bunch of case studies, a bunch of educational videos. The whole thing is just about education, value. I want you to get as much value as possible. But listen, I promised you that I'm gonna go ahead and give you my personal number. This is my personal number, 407-756-7139. And the reason I'm giving you my personal number because I get a lot of questions on social media and I cannot keep up with my DMs on Facebook, Instagram, and everywhere. I tell people, you text me on my personal number, right? Because everybody is asking about, hey Mo, what are those programs, that everybody's talking about? Like they talk about the Netflix of NCLEX. What is that? It looks amazing because people brag about it. Or the 4-week crash course, or the 7-day NCLEX smash, or the 3-day content recap. Listen, if you wanna know more about what we do, about our product, it's a free class. All you have to do is text me Blueprint, all right? Text me Blueprint. You sign up for a free class. We'll figure out the times, the time zones and everything. Like you talk to my team, we have 16 coaches on the team. We will take care of you regardless if you're a student of ours or not. We'll give you the knowledge so that you can make the best decision and what fits you. But my promise to you, and I've never broken a promise in the last 10 years, if I look at a person and I tell them, I will help you pass your NCLEX on your very next attempt, 100% guaranteed, then guess what? I will hold your hand and I'll walk you to the finish line, even if I have to carry you on my back and walk you to the finish line, all right? There's a bunch of testimony videos. We've got 27,000 video testimonials, YouTube, Instagram, Facebook, and all other social media. Check us out. If you have any questions, you got my personal number. And yes, I answer my text messages, all right? I get around 2,000 to 2,500 text messages a day, which is insane. But guess what? I love doing this, even though I can't be doing anything. But I record videos, I upload content on YouTube, Instagram, and Facebook. I do free classes all the time, and I go live and teach my programs because I love doing this. My mission is to solve the nursing shortage in the United States and Canada because we're done with that abuse. I don't want to say abuse, but it's like nurses are getting burnt out. Going to a medical surgical unit with a nurse ratio 1 to 5, 1 to 6 It's insane. How can you take care of 6 patients at the same time? If you get a case just like that, where you have to make so much assessment, let's say there were rape, or there were domestic violence, or there were more intense complications for the patient, then you gotta stay with that patient for like 2-3 hours. What happened to your other 4 patients or 5 patients? You know, all of them got medication, all of them gotta eat, all of them have procedures, x-ray, there may be chemotherapy, maybe like radiotherapy, like so many things going on. What are you gonna do with that, right? It's crazy. That's why we need to solve that nursing shortage. We need a nurse-patient ratio 1-to-2 or 1-to-1, all right? That's the best scenario. And how we do that? By helping you pass your NCLEX. And when I help you pass your NCLEX, you are helping me get closer and closer to our mission in this company. And that's what we do. 16 coaches on the team, all of us are nurses, no salespeople. All we do is help students every day pass this NCLEX. We have 20 to 25 students pass on the daily. All right, I'm not keep this long. I promised you with a content episode about neglect and about abuse, domestic violence. So if you're on YouTube, you can check it here. If you're on the website, then it's gonna be the next video. Let's go. And by the way, if this was any value, please share this video with a friend. If you are on YouTube, share this video with a friend. Help people get more awareness about proper ways to solve a case study. And if you're amazing, and I know you are, you send them to the website. It's free, ngn.com. Love your face, and I can't wait to see you on the next video. Let's go.